years old, soon to be 65 next week. And what will she be eligible for? Medicare. Thank God. She has untreated diabetes for more than 10 years. She had a stroke, which is why she lost her job, and her husband was working till he retired as a house painter. They can't afford insurance. She had, if any of you are familiar with diabetes, a hemoglobin A1C is what we use to measure how effective your care is, how good your self-care is, taking your insulin or your medicine. When she came into the hospital, her A1C was 15. Yours and mine is like 5. And our goal for someone with diabetes is less than 8. She's on insulin. We found a cheap program. Why we were able to get her all of our other medicines for different assistance programs until next week when she'll have Medicare. Why do we do that in our country? She also had some abnormality on an abdominal CT because there were some other CAT scan because there were some concerns. And she's begging me to keep holding off on our ordering the follow-up one until her Medicare kicks in because they will lose their house if they have to pay their bills. So I have on all my calendars, call Barbara, call Barbara, call Barbara on October 1st and put that order in. It's not, that's the way we practice medicine at community health centers. We have 138 staff members as of last year. 29 of them are providers, so doctors, medical doctors, osteopathic physicians, physician assistants, and nurse practitioners. We have social workers, and so I'll echo Bob. We do use volunteers and have interns from as well who do a wonderful job. We have 3 social work interns right now. We could not function without them, and we've been functioning for 5 years with no social worker. Yesterday, I needed to do a letter because somebody's electricity was going to be put off, and somebody else's lights were going to be turned off, and she got a bill because they moved into a house and they sent her the bill from the other person. How do people negotiate this in our community? It's not easy. The staff that I work with believes that they belong at Southeast. We believe in the mission that healthcare is a right, and everybody, no matter what, deserves healthcare. And our turnover rate, which just kind of surprised me, is 11%. And the national turnover rate for healthcare is 27% in the industry. So we have people that have been there for years and years and years giving healthcare. We have a lot of people with a lot of serious chronic illnesses like diabetes and hepatitis, obesity, and asthma. We run wellness circles where like a group of people with a diagnosis hang out together, have education, have kind of community support. We do videos, have healthy snacks and things like that. And that's a great way to have some support in your community. Oh my gosh, and people will, these are kind of bilingual mixed groups, and it's kind of funny because people will talk about recipes in their own languages and everybody is translating in between. It's very fun. One of my patients with diabetes, he also has some side effects from his diabetes, just lost his medical insurance. He swears to me he did not get the letter that said you need to re-up for this, so he's been without insulin for 4 weeks now, or 4 months now, until we could finally get him back on. Yeah, this is day after day, and this is America. So we have a little boy who had he was in our asthma group, and he had 8 admissions to the emergency room last year because of his asthma. How many dollars does an ER visit cost? $3,000, $4,000, $2,000, depending. So he's in the asthma group, and so far, since he finished the group where he learned how to do his pump better, and his mom learned when, oh, that's our one of our patients. Learned how to do his pump better. He has not had a single ER admission. So we're going to hope that that can go on for another year. But that's a huge saving to the whole healthcare program, which in turn would let us give more people care. We do prenatal care, and obviously from my CV, you know that that's what I really care about, taking care of pregnant women and their families. And I mean, I care about everybody's health, but. And I also take care of the prenatal patients at the prison. They come to see me at the clinic. So it's really an enormous kind of a melting pot of people with prenatal care. Does anybody know what the infant mortality rate is in America? Where we rank in terms of, go ahead, take a guess. Yeah, yes, perfect. It might be 35, but perfect, wonderful. 33. The United States of America ranks 33. Can you imagine how many countries are above us? Everybody, practically. And that should not be. The cost of neonatal intensive care, when I first started on the talking about keeping prematurity down, was $5 for every, and we could prevent it for $1 of prenatal care, $5 of NICU care. Now it's $1 for $10 of NICU care. So last night I saw a patient for whom who had preterm labor with 2 previous babies. Her cervix, the bottom of her uterus, is now short. She's 2 centimeters dilated, and she's been that way since 29 weeks. She takes medicine to keep out her contractions, and since she was 16 weeks pregnant, she's been getting a shot in each butt cheek of progesterone to try to keep her from having this baby too early. She's 33 weeks last night, and she's still, I checked her because she said, just check me so you can send me home for another week. Still just 2 centimeters dilated. She needs to get to 37 weeks. And I told her I'd give her a coupon to get her nails done if she could do that for us. That was, actually, she said, okay, I need a fill. So, anyway, in our patients, 92% were born greater than the low birth weight standard last year, and 87% of our babies had their vaccines on time. But that's not without a lot of phone calls. You missed your baby's appointment, please come back in. Just bring them in for their shots next week, and then I'll see them in a month. We do it all the time. The bulk of our patients are women of childbearing age and young families, because that's who takes the majority of health care. That's who brings their people to the majority of health care. But every day I see a new young man or middle-aged man who has not had health care for a number of years because either not being employed, just being out of school, working part-time where you have no health insurance. Sad to hear Bob's comment about people going to part-time. I have a patient with breast cancer who got emergency, well, now she's dead, but who got emergency medical assistance when she had breast cancer. She's working in a part-time job, and she's working just below the level that her employer would require her to have insurance, that they would be required to offer insurance, yes? So she came, and she's a smoker. So she came into the office with back pain, and it was really kind of unremitting back pain. She'd worked in where she was doing some kind of packing and moving things, so I treated that, but her exam was not very significant for back pain. And I was really worried about the smoker and the breast cancer, and I said, could you just get a chest x-ray for me? And so we did and could you just do that, and could we just check your back with just an x-ray to make sure it's not, she had metastatic bone cancer. So her breast cancer had spread to her bones, and 5 years out from cancer, she had no treatment, so and no insurance, and she died. This is not rocket science, you guys. This is about doing the right thing for the right people. And I feel like for many of you, I'm preaching to the choir. But it's important to think about the people that we see. We see the farm workers in Lancaster County. So every time you get a head of lettuce or drink a gallon of milk, those people are getting health care from us because of farm worker programs that recognize that the agricultural society is only sustained because we provide care for farm workers too. So the end. I saw Dan look at me twice.
Giving you the raised eyebrow.
Yeah.
And last but not least, Joe Arthur will talk with us about hunger in Pennsylvania and making national hunger.
And I'm going to stand up a little bit more like Kay. I like to be tethered. My only prop today is $2. I have $2. In the average coffee shop, you can get a cup of coffee from that. Not a fancy one. Not a fancy one. A fancy one's $4. Many of you have probably seen in the news the threats in the U.S. House to something called the SNAP program, Supplemental Nutrition Assistance Benefits, used to be called food stamps. Just know, wherever you come from on that point, that the average benefit under SNAP is $4.50 per day. Okay, so you can't buy a cup of coffee because that's ineligible. You could go to a grocery store, go to a farmer's market, and try to find enough food, healthy, nutritious food, for $4.50 a day. Good luck. I'm going to leave the topic with an assignment if you choose to take me up on it. Just recently, the CEO for Panera Bread, who's a wonderful gentleman, national food banking system called Feeding America, which our food bank belongs to. Did a wonderful blog, probably take you 15 minutes to go all through his 8 days, did it for 7 days. Then did a wrap-up, compelling. He's a CEO. He tried to do it. He was a different person when he was done, and I don't just mean because he was a different person in his outlook. He was a different person because his physiological changes made him a different person. You read the blog. It's easy to find. So, it's an honor to be here to talk to you, and our panel guests have told you a lot that actually builds some foundation for me. So, if I need to hook, you tell me.
I'll tell you.
All right, don't be subtle.
Okay.
Give me a holler, because when I get going, you'll need to do that. As the Executive Director of Central Pennsylvania Food Bank, I direct an organization that serves 27 counties in central Pennsylvania. You heard some of my bio that I'm involved in statewide organizations, so I do have a statewide perspective. There's about 1.9 million people in Pennsylvania out of a population of 12.8 that are food insecure. And the definition for food insecure, I'm not going to tell you because I can never remember it, and there's probably 100 definitions. They're hungry. It just means that at some point during the month, they don't have enough nutritious food. And since we're in a human rights policy conference, and don't forget my business background, 25 years, don't forget that when I say this. Central Pennsylvania Food Bank. Reasonable access is a right. Is a right. So anywhere in 27 counties, it's our job to find someone who is hungry and serve them. There's no maximum cost that we're going to calculate to do that. We're going to do our work as efficiently as we can. We're primarily donor funded, so stewardship is a huge deal, as it should be, but we need to serve them. We need to serve them. Linda talked about the evil eye. So if I want to call down the evil eye on the U.S. House, all I need to do is go tell them they look good. Awesome. I'll kiss them. I'll kiss them all. Because the biggest threat to adequate nutrition in decades is the U.S. House right now. Because for decades, we've had something called the Farm Bill, where the farm side and the nutrition side programs were put together, bipartisan support, through some of the most difficult times. And some of us are old enough to remember the early 80s. Other times, there were very difficult times. The latest recession was huge, but there were other difficult times. And we got through that with bipartisan support for the Farm Bill, which also funds SNAP, or what was then food stamps. Let me give you an idea of the impact. Know that the Feeding America Network has 200 members, like myself, Central Penn Food Bank, that covers every county in the United States. That whole network last year served about 4 billion meals. Big number, nobody knows what it means, but just keep that in mind. In November, because the stimulus funds we mentioned earlier are coming off the table, just sunsetting because that's the way it was written, that's $5 billion. $5 billion. Average meal costs about $2.50 in the United States, regardless of what the average SNAP benefit is. The threat of splitting up the Farm Bill is $40 billion in cuts to the SNAP program over 10 years, which is $4 billion a year, right? And I know math at 10 o'clock in the morning is a little tough, so I'll do it for you. But if you take those two numbers and add them up, 5 plus 4, you just equate it to more meals being pulled out of the grocery store system and the farmer market system because of those cuts. So the fig leaf that's being sold is that the Charitable Food Network can make it up. Can make that up. It can make it up for 10 years. I'm here to tell you, and I've gone public, on TV, whatever, no way. Forget it. Anybody tells you that, call them on it. Give them my number, I'll drag them through our warehouse, show them how it works. We expanded our warehouse with donor money. Last year we completed it. Ran to the hilt and increased our distribution by 30%. 35%. Now, we work with community programs, like our represented here and many others. We have 800 of them in 27 counties. In Lancaster, we have about 80 partners. They serve people in need directly. Our job is to get them food. We worked together and increased 35% last year because we expanded in a huge way, put a lot of money into it. The chances of us increasing another 100%, pretty slim, okay? So it is actually a very, very big deal, very big deal. That's the biggest threat in decades right now. Bigger than the recession. The recession increased the number of people in need coming to our network to about 54,000 people a week right now, a week. About 75%. I just told you about 100% right out of the gate. It's a big deal. So I'm going to get off that soapbox before you pull it over. So I told you a little bit about how we work. Now the good news. Like in other areas of helping folks in poverty, there's one good thing about budget tightening is it forces innovation. So we've done that as well. And one of the great success stories around the country and here in Lancaster County is the amount of fresh produce and other very healthy food that we've been able to put into the network. So we actually tripled that last year, that expansion I talked about. Most of our increase actually came by putting in cold storage at our place, which is a hub, and throughout our network, helping our partners to afford all of that. And so we tripled the amount of fresh produce in our system. That's a wonderful thing. That can be done on even a larger scale. And if you're involved at all or want to be involved with community gardens or anything like that, I encourage that because between that and our community or our network, we can have a great impact on people's nutrition just by doing that. Won't make up for SNAP cuts, but it'll help. I looked over there at the photographs of folks in poverty, and it reminded me to say that folks in need look a lot like us. Like today, they might not be wearing this jacket, but they look a lot like us. In our territory, our clients look a lot like the population statistics, all right? Poverty and hunger are equal opportunity destroyers. They really pretty much map over the population statistics. So anything to the contrary that you hear, not true, at least in central Pennsylvania. Another key fact I want to put out there today, not that homelessness is not as important, it's very important. We've heard today a lot about that. But only about 4% of the people coming to our network are homeless, which means the other 96% have a place to stay. They have a home. That fact alone usually is an eye-opener for folks. It was for me when I came to the food bank, actually as a volunteer director years ago. Huge misperception in the public world. Most of the people coming they're kind of average folks, whether it's job loss, job cuts, benefits cuts, and we're going to see more of that, with the battle going on with healthcare. To try to make it fail, by the way. Let's leave that out there. Disabilities, medical issues. A third of our clients are children. 1 out of 10 are seniors. They're not working. Hopefully they don't have to work. Many of them do, but come on. It's not just lazy people. It's not. If we only had to feed lazy people, that'd be easy. That'd be easy. You wouldn't need me. You wouldn't need this big network. You wouldn't need all that SNAP. That would be easy. That 1 or 2% of the population, quit worrying about it. Who cares? Who cares if they get an extra bag of food? Did you ever walk into a pantry and get a bag of food? It is the most humbling thing you ever want to do in your life. You do not want to do it tomorrow, the next day, the day after. You are not getting rich. Forget about the 1 or 2%. Have your food, whether you need it or not. If the country club set comes and wants food, I'll give it to them. Just shut up, go, move on. It's the other 98%. That's who we're trying to serve. That's what really matters. And I have a 25-year business background. Don't forget it. Also, it's not not just an urban phenomenon. It's not just Lancaster City. It's not Philly. It's not just Pittsburgh. It's almost 50-50 between urban and non-urban in terms of the number of people coming to our pantries. It's about half and half. So all throughout that 27 counties, we have severe rural poverty, and even in Pennsylvania. But we also have suburban poverty. Enfield, right? Manor Township, Hershey, they all have pantries, and not just one. They all have pantries. Unbelievable, right? Unbelievable. And I'm going to close on two things. One thing is, remember those bread lines that you see in the old pictures or the Depression, right? That's what most people associate with American hunger with. Not even close to international hunger, which looks a lot different. That's part of the problem. Those lines still exist. Organizations like ours are doing it with dignity now. So those lines are inside. And they're certainly not on the way to work for our legislators. They're not seeing them. But they're there. They're inside. They're inside. They're being cared for. We're not making them stand out in the street. They're inside. So maybe success is hiding the problem. Why people like me have to come out and yell in the morning about it. The other thing is, how can you help? How can you help? We need volunteers. That's a big part of what we do. We get over 3,000 volunteers a year just at our place, and our whole network is about 99% volunteerism. There's always need for volunteers. If any of you are independently wealthy, just showing up at school because you like to study, we'll take money. Food drives, wonderful. Great awareness raisers, good food. We sort it all. We need volunteers for that. You can help that way. Here's another one. Off the beaten track, but I'm encouraging it. The voice of the people needs to be heard. But in order to be heard, they need to be registered to vote, and they need to get to the polls. You guys can be very good at that. Get out into the community, help people to accomplish their civic duty. Help them to do that. That'll change the conversation better than guys like me out there. I'll leave it at that.
We have a few minutes for questions. Yes.
Yeah, this is a question for Joe. I was actually down at the Capitol building on Tuesday morning, and I saw several different hunger organizations there in the lobby. And I was wondering if you were able to, while you were there, lobby, and if so, what the reaction was from the legislators.
Well, you know, I'm going to give the Pennsylvania legislature a lot of credit. We don't lobby, because I'll lose my 501c3 if I lobby. We educate, we advocate, and we advocate strongly, and we were there in part to do that. So we were sending a message, all of our statewide organizations, sending a message about hunger. We did a canned hunger drive. We lined up cans outside right up the Capitol steps. Did a whole, about a half-day session inside of just talking to folks in the East Rotunda. The Pennsylvania legislature, at least with respect to fighting hunger directly, not many of the other things that actually tend to cause hunger, is actually very supportive of what the food banking system does. So we're one of the few states that has some special programs to help put some money into the networks. So I do give them credit. Actually, Monday, the legislature, we have 50 legislators signed up to play in something called a Capitol All-Stars game at Metro Bank Park in Harrisburg on Monday. They do help us. We have a champion right here from this county, Senator Mike Brubaker, who's our Hunger Caucus champion. And I have to tout his praises. He's also going to join us very soon to be our honorary chair of our Lancaster Hunger Coalition. So I give our legislature some credit for that. But we are there a lot, trying to work for those programs. Big part of what I do. What was your name?
Lauren.
Lori, thank you.
I guess I'd like to piggyback on your statement. 2 years ago, I found out that we have a food bank here at Millersville University for our students. So it's not only that people who are hungry look like us, they are us.
Yes.
And I think if at all you can help the food bank
Not microfinance per se. Teaching people how to be entrepreneurs is probably beyond what I would call Tabor's core competencies. There are some organizations, some nonprofits in Lancaster that do that. Assets and SCORE are some examples. We do have a micro loan program that was funded through the generosity of the Lancaster County Community Foundation. In a few cases, people have used those loans to help support a business they were trying to start. In most cases, the loans are for just living, paying rent, paying a utility bill, and so forth.
I can't fail to say how glorious the energy and intelligence and wisdom of the four of you is.
Are you talking about our age? I'm just curious here. No, sorry.
Because it was hard for us, it wasn't that hard for us to get up in the morning, because we're old.
The question I have, prologue is, I guess we know what it is we would ask Joe Pitt or his successor to do in the Congress. What is it that we should be asking our state representatives in Harrisburg to do for replacement?
Read.
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 Read deeply.
Read, yeah.
You know, stop putting the political points out. Stop working to the agenda of that fella in Washington with his no tax pledge, Grover Norquist. Let's work for the people. Honest to God, I think that's the message. And read. Yes, actually read. Learn.
Because everything that the blurbs that you see are like, as soon as you read down 5 lines, it's wrong.
Perhaps Millersville and other universities should open a school for legislators.
For legislative rehab.
That's it. I like
For
that.
rehab. It should be
Rehab.
legislators rehab.
How about when you have alumni reunions, gathering all of the teachers in one room and all of the social workers in another, in order to help them to work together to change the whole
So, and I think we'd say, if our advocacy person was here, is that it is the people. I mean, we have found from the Alliance perspective that constantly talking, I think, we're always sending stuff out about, talk to your legislators, and, and it's not a huge thing, but it really, one time is not enough where we think, well, we're just one person, and we have seen when people really start coming together, again, as a community, not only to solve a problem, but as a community effort, that eventually you can start doing it. I mean, we can sit back and just say, well, we could go and it's not gonna make any difference, but we believe that it does make a difference because we've seen it. That's why we have an advocacy policy right on by the way, the National Alliance in DC only has 19 staff. People think we're huge, but we're not. But because that's so important, we actually have 2 staff assigned just to work on the idea of advocacy and education, to keep that whole policy stuff moving. And we look at policy all the time, then we take that policy and say, we've researched this is a policy, this is a truth, and continue to do that. So, every time you get those requests to send those letters and to make those calls, you got to do it. You can't expect the next person's going to do it.
As frustrated as I get with lawmakers, both at the state and the federal level, I mean, in my lifetime, I can't ever remember when Congress was held in such low regard as it is today. And yet, they all keep getting reelected. Yeah. Now, how does that happen? Yeah. Huh? So, I mean, the voters in the end, the citizens and so forth. My wife keeps saying, there's going to be an uprising. Sometimes frankly, I hope she's right. But I don't know. But, these legislators that we are so frustrated and angry with keep getting reelected.
One more question, or?
Yeah.
This is a comment, actually,
Oh.
to the students that are here. You've heard from our community partners like Southeast Health Services, Tabor, Central PA Food Bank. You've heard from them how valuable and how much they depend on Millersville University interns and volunteers. So this is my shameless plug for experiential learning and career management. We are the office on campus to help connect students with academic internships and community service placements. to get you in the first step of that.
We also take interns at the Alliance, and we get interns from all over the country. We had 9 interns from across the country at the Alliance this summer. They're not paid, but we do internships.
Right. So spend your
Just
summer in
saying.
your major, absolutely. Yeah, regardless of your major.
And one last question, you.
No, I was just gonna say that I'm actually old and jaded as well, and I no longer hope for Washington to fix our problems. And I think, and almost all of you mentioned this, that it's about community and getting to know our neighbor and knowing when my neighbor needs to know where the food bank is because her husband's been in the hospital and she's lost her job, and because my kids are college age, teaching these young people that, you know, move into areas where you know your neighbor and help each other out. It sounds really kind of Pollyanna, but don't sit around and wait for Capitol Hill because they will.
And I'm going to just say, because I know Deb, and Deb does that. She lives in a community that many of us would choose not to live in. We talk about, you know, nice, safe, affordable neighborhoods, and where we should move people. But I think Deb's been willing to do that, and I'm also going to say I'm friends with her on Facebook. And she does exactly what she's saying. Like, she, all the time, is reaching out to her neighborhood. So we can choose to live where we live or go back. But she lives what she preaches, so I just want to say that. Not all of us do.
But you guys are here because you believe this is important and you need to live it. I could make a lot more money in private practice, as could the other 29 people and 4 more coming. It is, I know. All right.
You wanted to say
Anyway.
something. Yeah.
And who would, if you don't want to do that, if you want to care for the community?
All right, we'll take one more question.
With everything that you guys are saying, and as you just said, you can make a lot more money in private practice. So to me, you guys seem very selfless, and through that, I just see like the heart of the Lord through what you do. So I was just wondering if that impacts any of you through what you guys do.
I just want to put, even though Central Penn Food Bank is a secular organization, we really work closely with any community organization that's just willing to follow the rule set. And about 2/3 of our community partners, pantries, missions, shelters, et cetera, are actually faith-based. So the faith-based community, extremely important. For me personally, it is as well. I believe in Matthew 25. You know, I think it's clear. You know, I don't need to debate it. But I just wanted you to know how big the faith community is and what we do. It's really huge.
I know we could talk more and more. I want to bring everyone's attention to the Faces of Homelessness photo exhibit that's here in the room, which is beautiful photographs that were done at Lancaster Country Day. School students, I think, took those photos, and there's some really interesting stories that accompany those photos. You can look at those on the way out. And please join me in expressing our gratitude to our 4 panelists this morning. Thank you all for coming, and enjoy the rest of the conference.